Ask yourself this question: how many people do I know that have pets? How many of those people love their pets like family? How many people love their pets more than their family? Guys, listen, we are incredibly blessed and honored to have an incredible woman as a member of our medical advisory board by the name of Dr. Joli Jarboe. Joli is a dear friend. She's one of the most amazing people you'll ever meet in your entire life, and her credentials back it up, guys. After graduating from the Auburn College of Veterinary Medicine, Joli has become, guys, one of, I believe the number is 316, okay, veterinary neurological surgeons board certified in the entire world. Guys, she's a published author, a globally recognized expert. She's also a very proud Zilis ambassador, member of our medical advisory board, and she, again, her expertise in things such as neurosurgery, brain and cervical neurosurgery, but this lady has a heart of gold, and she is changing four-legged lives with Ultracell. Dr. Joli Jarboe, first and foremost, on behalf of the entire Zilis family, we love you, and we appreciate everything that you do to serve this entire team with so much passion. We are so excited tonight to understand this side of what we're doing here at Zilis, which is how this product is changing lives. So, Dr. J, we're going to throw the floor over to you, young lady. Take it away and let's have some fun.
Thank you so much, Stephen. You know, I'm always humbled whenever you all introduce me. I come to this, you know, as a veterinarian, and it's, for those of you who've not listened to me talk before, you know, I actually started in veterinary medicine when I was 11. The veterinarian down the street, he put himself through veterinary school to pay books. He bred canaries and finches. So he got out of school and had 300 finches, or 300 canaries and 150 finches. And I'd get off the school bus and go clean cages for these birds for $1 an hour. So I have a little bit of a James Herriot story in my background, but I really couldn't be anything but a veterinarian. And so when I hear people talk about what I am in the grand scheme of 315 or 350 boarded neurologists, that always kind of takes me back because I'm just used to getting up and going to work and being with these animals and trying to find some way to bring comfort to their lives and comfort to their clients' lives. Not always successful in that, but you know, the majority of the time I am. You know, I'm so motivated to do that. And to give you all a little bit about me, you're going to hear two things. You'll probably hear a little waver in my voice, and you'll hear me stammer and stutter because I don't like to speak publicly, but Zilis has really, and Stephen, you know, he pushes and prods and he gets you out there, has made me step out of my comfort zone. And the bigger reason for being here tonight, and every time I get up in this platform to speak to anyone about cannabinoids and Ultracell in particular, is because I do believe passionately in it as a supplement and the benefits that we all can take from this. You know, getting away from big pharma and all of the medications. You know, we're so over-medicated. Dr. Andrew speaks about this so passionately and so eloquently about, you know, taking medication for one thing and needing 3 and 4 additional medications for the side effects of your first medication, when we really need to sit back and take a look at health. You know, one of Dr. Andrew's big drives, or one of the things that he said that has stuck with me from the first time I heard him speak, is that we are trained in this part of the world to treat disease. You know, we're trained to teach disease, or treat it and see it. We're not recognized to empower health within ourselves. And I think that's where we got wrong. You know, that's where we got it wrong in our education system. I think we need to really get back to that and learn again how to enhance our health. And that's, I think, the beauty of Ultracell in particular. We know the cannabinoids are so powerful within our systems, and Ultracell with its, you know, processing technology, micelle and liposomal technology, allowing us to absorb far more of it and therefore give ourselves more cannabinoids to work with, you know, just potentiates the health within. And that's what I've seen in the veterinary side of things. And that, again, that's why I get up here and talk and speak and try to educate people on the benefits that I'm seeing in veterinary medicine with this as a supplement, you know, just an overall health in our pets and animals. I remember when I first came into the Zilis family through Sandra and Joe Davis, in talking with them, I kept telling them, I said, please, is there any way I can talk to Stephen? And I can tell all of you all that this man, we all say it whenever anyone gets a microphone in their hand or an audience to listen to, we all go back to the leadership, and Stephen certainly embodies that. This man who's trying to run this company, get this company going, took my phone call, I think probably within me being an ambassador within 10 days or so, because I had looked at the Zilis website and saw their pet products and really felt we're missing the boat here. We've got the human side, we got the two-legged people and the people that write the checks and swipe the credit cards, but those people are driven to enrich the health of their pets. There are so many clients that I have where their dog or their cat is their child or their surrogate spouse or parent. These animals are no longer, thankfully for my profession, the majority of us, they're not tied up to the tree out in the back 40. They're in the house, they're sitting at the table, or they're getting table treats, snuck underneath the table while people are eating dinner. So they're intricate in our family. And so by that token, Stephen and I had a long talk about, what I thought this company could do for the animal side of things. And it wasn't long after that I think this blew up and became equally as relevant as the human side. So when we look at this, I'm not going to really go into the science much of it because Dr. Andre does that so well. But, the big thing, the big take-home message there is anything that has a spinal cord does have an endocannabinoid system. So our dogs, definitely, our cats, our horses, all of these, the reptiles that we have, they all have a spinal cord. So they've got the same endocannabinoid system we have, the same at the cellular level. We're just a few little DNA markers away from being one another. So we're so close on that it just makes sense this product can be used safely in our pets. I'm countered a lot by the naysayers that, where's the proof? Where's the proof that cannabinoids or that dogs have an endocannabinoid system and that cannabinoids can be beneficial? And I always counter with, if you go to one of the scientific search engines, a scientific journal search engine called PubMed, this slide I'm sure is outdated. I think I did this slide or pulled this up 3 to 4 months ago. When I first started with Zilis about a year and a half ago, my slide read over 3,000, it was like 3,050 citations. When you plug in endocannabinoid system and animals, PubMed gave me at the start about 3,000 scientific articles. Well, 3 or 4 months ago, I plugged it in, and we've got greater than 6,000 articles with just those 3 keywords, endocannabinoid system and animals. So I always counter and tell people that the science is there. It might be backdoor science in a way because my patients, my animals, are what science is basing the safety of these products in humans. Sadly, they're going to take rats, or sadly or happily, as it depends on how you look at that. They're going to experiment and do these studies on half-life, lethal dose levels, indications for use. Those are all going to be done on animals first. That is the safe way to do things. I may be offending some folks out there, but I'd rather that be done than our children, or I think that this is a safe way in learning, and so the science is out there. There's probably over 30,000 scientific articles about endocannabinoid use in humans. And the basis of those, the skeleton of those, is work done in animals first. And I just cut and pasted a few of those or printed up a few of those for you all to look at. But I think one of the big take-home messages is that in our animals, they have so many of the same problems that we have. And that is why they are the models for human study. When we roll into, looking at animals that come to see me as a neurologist, Dr. Andre talks about, or educated us on the endocannabinoid deficiency syndrome that is getting a lot of press, and for real reason. And I think that we have that same issue in our animals. I think there are a lot of processes within the body that are deficient in this because it's been taken away from us. It's been absent in our food, in our building materials, in our plant bedding materials for over 80 years now. And I think that's kind of taken our toll. And some of the common problems I see as a veterinary neurologist that really I should have the same slide that goes over the cannabinoid deficiency syndrome diseases, because they mirror each other in so many ways. We have, when I started in vet school, the professors used to teach us that dogs, didn't have post-traumatic stress syndrome and didn't have headaches, a lot of things that were just old school mentality. And I would counter with that. Having been around animals for, when I started to crawl and then working for a vet at such a young age, I called foul on that. Anyone that's had a shelter dog or a shelter cat has seen the internal turmoil these animals go with, and it mimics post-traumatic stress syndrome. You also have animals that keep you up at night, licking the carpet, or they lick their feet, or they suck on their bedding. Those are all OCD type behaviors. Hopefully no one's licking the carpet, but, we do odd things, roll our fingers or wring our hands, maybe have excessive scratching. All those things can be OCD type behaviors. They have anxiety. A lot of behavior issues go back to dogs, coming into the household, being under this pack influence, and we've brought them in the house, and we've elevated them really to be kind of a, unbeknownst to most humans, when they're babying them or putting the animal first on so many levels, it puts that animal as the pack leader. Well, you've got your 7-pound Yorkie that's trying to, take control of the whole household and be that dominant animal, but wanting to be the pet and submissive, and that can create a lot of internal conflict in an animal that sits and shakes or barks if a leaf brushes up against the window. So there's a lot of internal turmoil between these little creatures' ears that we brought into the house, but also that might be out in the barn. If we've got horses that, want to be a pack animal, a herd animal, and they're, maybe they're one single horse. They need a lot of socialization. They want to have that herd, and so it's important that we spend the time with them. The biggest one I'll show a slide of it, are these are large birds. These birds imprint on us and want, a lot of these little birds are bought right as they've hatched, and they're imprinted on the person feeding them, and they grow up, and then there's a lot of teenage years they go through, and then there's a lot of sexual frustration that they go through, and they become quite menacing to the family. And a lot of these animals with inappropriate behavior that we've kind of imposed upon them will end up in shelters or turned over because it's just undesirable traits. So as we kind of go through this list, I always joke that all these things, anxiety, aggression, fear, OCD type behavior, post-traumatic stress syndrome, seizures or seizure-like events, pain in any part of our body, tremors and movement disorders, weakness and paralysis, and then the one that I always joke about is the inappropriate marking, because I think all those other things we can see on the human side of it. And I had the opportunity to live in Vegas for 5 years.
Excuse me.
Pardon?
Sir?
So I had the opportunity to live in Vegas for 5 years, and so I tend to joke that, I did get to see some human inappropriate marking, sadly, for people that had a little too much of Vegas. So I guess what stays in Vegas doesn't always stay in Vegas, because I'm reporting about that to you all now. But when we look at the cannabinoids and what they can do for all this list, anxiety, aggression, fear, OCD-type behavior, post-traumatic stress, seizures, pain, tremors, inappropriate marking, weakness, and paralysis, we've got drugs for those. I've got medications that will help, but those medications also cause a lot of blood work abnormalities, or you need to monitor to watch for those problems. And we can get the same side effects that you can in humans as well. So one of the things I love about the cannabinoids is it's a natural supplement. I don't have to do a lot of blood work monitoring. A lot of these animals have anxiety, and when we give a supplement to an animal that's nervous, and if I have to give them a medication to treat that, something like Prozac or amitriptyline or even trazodone, those animals have to be brought back into the hospital and reevaluation. So that's not really part of what's going to help them have a better life if they're already anxious. Get them back in a car, get them back into the clinic. So I love the aspect that a natural supplement in a small volume, and so how it's so easily given, can help these animals cope and perhaps be a little calmer, a little more stable between their ears, so that they don't have to have these additional stresses. And the bottom line is it's everywhere. I always tell people, the picture that is on the screen now is a picture of a lot of pet products that I happened to buy instead of taking a picture of when I was at the pet store, and I brought them home and displayed them on the shelf and was so proud of the picture. And my wife looked at me and she said, well, you probably could have saved some money had you just taken a picture. And I'm like, well, I was really excited. I'm sorry. So we have that there. But sometimes I don't think it out quite that well. And the other thing is, we have all these supplements out there. It's in every journal. So people are coming in educated on it and wanting to know, interested because they've read something about it. And one of the things, just circling back to how I got involved in this, is I've used the cannabinoids for probably about 12 years now. The oils came into play really strong for me in my clinical setting about 4.5 years ago. And it's really through the clients coming in and asking, because veterinarians have a governing medical association called the AVMA, American Veterinary Medical Association Board, and they came out with a proclamation about 2 years ago, a year and a half ago, saying veterinarians can't talk about, speak, or discuss anything to do with cannabis. Well, that at the time, hemp oil fell into that category. And I just, again, I had to kind of poo-poo that. I mean, if I can, if they can tell me some of their deepest, darkest secrets, or, I've never had handcuffs put on me about talking about a possible health aid or health supplement. And so clients were bringing product to me left and right for the past 4.5 years. And I spent a lot of time talking to CEOs, a lot of time looking for certificate of analysis and ultrasound. Zilis came into my life, as I said, about a year and a half ago with Sandra and Joe Davis. My sister introduced me to them. And when I started reading about what this product was about and saw the bioavailability study that we had showing up to 94% absorbed in humans in the first 15 minutes with sustained blood levels for 12 hours. I had not seen anything like that or comparable with any of the other products, human included, that I had researched for the past 4.5 years. So it was a done deal. Sandra and Joe had me listen to the presentation slide that we had. But all I wanted to do was give them, the credit card to sign up, because I wanted to get this in my hands. I wanted to have this available to my clients, because in the end, I wanted them to have the best product, because there's so much out there that just is subpar and potentially harmful. Some of the things that set ultrasound apart, I know you've all heard this before, but the fact that when you're looking for a quality hemp oil, the things that I love about ultrasound, I love that it's full spectrum, because we're getting the full effect of that entourage effect. Over 480 biologically active ingredients in this hemp plant. Over 100 of those are cannabinoids. CBD is one of those. We don't really have an understanding of how they're all working together to get this great enhanced cellular potential that we're seeing. It's like Jenga. If we take one part away, is everything going to fall apart? So I'm not a big fan of the isolate oils. I think the full spectrum hemp just makes the most sense. Nature made it this great. Let's not muck with it, because look where it's gotten us over the years, mucking and tinkering with things. We've got a lot of problems because of that. So I love the fact that it's a full spectrum hemp oil. I love the fact that it's USDA sourced organic. This hemp plant is a bioaccumulator, which means it's taking in all the nutrients from the soil at the same time, all the pesticides and fertilizers and toxins. They use it to clean up fields and rivers, and then people will sell that oil back to us. To be USDA sourced organic means it's gone through some more thorough, exhaustive testing to be sure it is as clean and pure of those contaminants as possible. We all know about the water solubility factor that Ultracell has. There's a lot of products out there that are water soluble, which does increase absorption for up to about 40 to 50%, better than a true oil, which is at best 6% absorbed. But with Ultracell, the micelle and liposomal technology, we're seeing up to 94% in humans. That's got to correlate to our dogs because the other studies do. It may not be as high as 94%. We just don't know yet, but I can tell you anecdotally and on the clinic floor, I'm getting great results with lower doses with Ultracell based on other animal products. And I think it has everything to do with how we process our product. I love that the onset of action is within 15 minutes to 30 minutes, and I can see that in the clinical setting. We've got an owner that has a Shar-Pei that comes in to see me. I did neck surgery on her for a ruptured disc, but she's come in now 3 times to have her toenails trimmed. And the owner requests that we give a dose of Ultracell, and we wait about 15 or 20 minutes and then go and trim this dog's toenails. Shar-Peis, I love them, but they don't like their feet messed with, and you're going to get, they're going to throw up on you, they're going to pee on you, and they're going to poop on you and express their anal glands and create quite a ruckus for the most part as a breed. It's a breed bias. No one send me any hate emails. But this dog just really relaxes, and it's not a big deal for her. Her owner cannot get over it because she's a 5-year-old dog, and she's struggled for 5 years until the dog had to rupture a disc in her neck and see me for surgery, and then stumbled upon this little bit of relief she can have to keep her toenails short. So we've got our dosing chart in there. What I've worked out, again, the majority of animal products out there are basing their dosing on 2 to 4 mg per kg twice a day. Well, we know if Ultracell has such enhanced bioavailability, I worked at cutting that dose down by 50 to 75%. And the dose that I work with Ultracell is 0.01 to 0.2 mg per kg twice a day dosing. It's a lot of math that you don't really have to worry about. It gets real easy real fast. It's about, on average, 1 drop to 2 drops per 20 pounds twice a day. And that's not a dropper full. That's a very small amount. It's literally 1 drop, which equals 0.05 mils, to 2 drops, which is 0.1 mils of Ultracell per 20 pounds twice a day. On dogs, I like to put it on the inside of the upper lip or on the gums. On cats, a little bit more tricky. Cats, I like to put it on the philtrum, and that's the split between the upper lips beneath the nose or on the inside of the front paw or wrist, because they're groomers. They're going to lick it off. And so that just makes it a lot easier to dose instead of trying to chase a cat around with something that they're not really, unless it's their idea, a cat's not going to be down with this. So most of our household pets we can pet and touch and, bop them on the nose a little bit and hopefully have a drop of Ultracell on our fingertips to, put on that little philtrum or split. And hopefully they're no worse. They go ahead and lick that off. And I've got a lot of cats that actually end up loving it. I've got a video of a cat licking it out of a spoon. Someone sent me a picture of their cats waiting on the kitchen sink to get their evening dose. So it's certainly, versus trying to shove a pill down their mouth. Cats get very dramatic pretty quickly and get an Oscar for most of the time when you try to pill them, with drooling and vomiting, and then they run and hide for 3 days, and you don't know if they're better or not because you got to go try to find them. Horses and hens. Boy, I hope Todd's missed on the call here because I'm going to talk about this. I know we're running out of time, but I love what I'm hearing from the horse folks out there. They're seeing a lot of benefit with the oral Ultracell and also the topical. This is going to be the one animal I'll talk about to the general public with topical because they get a lot of soreness between the poles, which is the area behind the ears where the bridle has a lot of pressure at the top of the neck. They get some saddle soreness. We all know that they get limb issues. And so putting this on topically, the topical Ultracell, a lot of these animals are showing improvement in movement, improvement in comfort, showing a more relaxed attitude with the addition of a product like Ultracell. And we know that's cannabinoid driven because we've got the proof that cannabinoids are anti-anxiety. We know they help promote anti-inflammatory mediators. We know that they help with muscle soreness. So there's so many ways that this product can be beneficial, and we're seeing it. My biggest concern with it initially was you've got a 1,400-pound animal. How are we going to dose this? But thankfully, the horse is taking a human dose for the most part. Most people using it are telling me they're getting away a 1,400-pound horse anywhere from a half to a whole dropper full 1 to 2 times a day. And I think that makes it so much more financially feasible. If they're taking a 30 ml bottle a month and getting relief versus putting them on some harsh medications like butazolidine or any of the NSAID medications or Banamine, any of the steroids. Again, going back to a nutritional supplement, I'll do that all day long. The topical, I think, is showing some benefit as well from what I'm hearing with animals that have fat loss issues or they've got any swollen joints. A lot of people will see that, or hives, with the oral. A lot of horses have allergies just like we do. So, again, I think I'm so pleased and happy that these big beasts are getting some comfort. This is a poor, frustrated bird. Feather plucking is such a problem with these large birds, because they're so smart. We've taken this bird and put it in a cage, and we've imprinted it on us. When they start to reach sexual maturity and get a little bit more rambunctious, there's a funny thing on here that says, all madly hormonal. This is Dr. Robert Silver. He's a veterinarian that has his own nutraceutical company, but they're looking at dosing his product for birds for specific conditions that are on this slide, epilepsy, feather plucking, lovebirds, but they're terming improvement seen in quotations of all madly hormonal, and all I can think of is like a 14-year-old girl going to see Justin Bieber, but this is a bird that doesn't quite know what to do with himself, and so sat in a cage and very frustrated and starts to feather pluck. They can mutilate themselves to a significant degree. I have a couple of veterinarians that are using Ultracell now, and I have suggested, going 50 to 75% less of the normal bird dose. And you can always dilute this out, 1 drop in 1 ml of water, because these birds are so small, it is hard to get their weight unless you've got, a very small, even a milling scale. That's what a lot of bird folks will use to try to dose these. And a lot of people end up kind of cheating a little bit and putting 1 drop in their daily water for these smaller birds and getting good results. So, again, I think because of Ultracell's bioavailability, a lot of the pet products that are out there that have doses, I think we can just extrapolate, 50 to 75% less because our product is being absorbed so much better. We've got a lot of video and pictures of dogs. I'm not sure who all can see. I'm showing a picture of a little collie puppy named Hazel that came to me for circling behavior and having issues with thresholds, and we imaged her with an MRI, and you can see, if you know animals, when you first evaluate her being a collie, collies are known, Lassie, to have that very long, skinny head. Well, she had a big round skull like a chihuahua. And so I kind of knew, doing this for so long, that she probably had a condition called hydrocephalus, where she was either making too much spinal fluid, so the pathways for spinal fluid flows through her brain are too large, or she wasn't absorbing the spinal fluid she was making. And that can lead to a loss of normal brain tissue. And so we imaged Hazel with an MRI, and she really, her cortical brain mass was probably 90% smaller than it should be because of the large volume of fluid that she has in her brain. Well, she was a rescue dog, and she did need surgery, to try to drain that spinal fluid from the brain to the abdomen. The person who rescued her, just really didn't want to do that because it had a low chance of being successful since this was a congenital issue. And so we tried the traditional medications to decrease spinal fluid production, which is steroids and diuretics and some pain medication, but I also added Ultracell to all of this. I don't know how, because if you all could see the images, there's just really little normal brain tissue left. But she's off all of her medications and just on Ultracell now. And her compulsive behavior to circling, these episodes of manic barking, they're all gone. She's not a normal dog by any stretch of the imagination, but she's definitely much more functional and happier, and is blessed to be with this this person who's going to give her a home for, however long she's going to be here with us. And so, again, a win, a win that we've kept this puppy from, being put to sleep or having a shorter life because she's having a functional, happy life. Lost my track on my slides here, Stephen. Give me a second. I think we'll just go to forward.
You're doing awesome, girl.
Other potential uses that I see, there's an anxiety, a stress-induced cystitis in cats called FLUT, feline lower urinary tract disease. As a neurologist, I don't really have to treat that much, but I hear about it, and we use a lot of the treatments that we use, again, are anti-anxiety medications, Prozac, amitriptyline, antispasmodics, anti-pain medications, things like Xanax, antibiotics, urine acidifiers, diet changes. I mean, this disease has had probably 5 different names since I started working for a veterinarian when I was 11. And it goes back to the fact, again, I apologize for pulling out some of my old jokes, but they're hardcore beliefs I have, in that cats are aliens. They meant to get in the human form, I think, and got mistaken, and so they've spent the rest of this time trying to call in the mothership, and they're really aggravated for the most part. They're here with us, and so they have a lot of stress-induced issues because we just can't meet their needs. We're here to serve them in their mind, and anything that sets them off, cats, if you bring in another cat to the household, most cats have a hard time with that. Someone's, maybe constructing a house next door to you, or you've got a visitor in the house that's going to set them on their ears, so to speak. And I say it laughingly because I love cats. We have them. I think they're awesome. But in the clinical setting, in the hospital setting, I want them to be a dog, and they're just not. You can't fool a cat. They're too smart. But this feline urinary tract disease, lower urinary tract disease, is really stress-induced for the most part. So anything that sets them off, they're going to start to strain. They're going to pee outside the litter box. They're going to, just wreak havoc with owners. And that's going to get a cat into a shelter. And so I've started, when I hear about this and talking to other veterinarians that call me about different issues, or technicians that have cats struggling with this, I'm quick to say, why don't you try Ultracell? It's not going to hurt. If we can come at it and try to just help them enjoy themselves a little better, that life isn't that tough, we might see some positive effects. And I can tell you that we are. That I've got some cats out there that are off all their traditional medications. Doesn't sound like a repeat record, doesn't it, on the human side? But they're doing so well with just this supplement. And they're peeing inside their litter boxes and not out. Well, that's a cat that we've, potentially kept out of the shelter one more time. So that's a win in my book. And I know I'm going over. I always have to bring Samson into it. Samson was there's a picture of a standard poodle on the slide on the screen presentation, and he's the very first dog I used Ultracell on. And when I signed up with Joe and Sandra, I bought the gold pack right away, and I didn't sell that gold pack. I gave that away to clients to use because I had to see for myself, was this going to be as good as I thought? And I didn't feel like I could sell that. I wanted to give and learn and see. And Samson was a dog I never met. And, as we talk about veterinary medicine, there's 2 big differences in human medicine, I think, and veterinary medicine. One is the absolute, never-ending or it's just unconditional love you get from your pets. Our parents and our children, we love them unconditionally, but there's always little things, little things that tweak us or irritate us or can poke us the wrong way. But, your pet, they just love you. I mean, there's no other way about it. And the other thing is, when it comes time for end-of-life decisions in veterinary medicine, I may have a different mindset than most because I have been involved in this at such a young age, but I think, and trying not to get too teary-eyed about it, I feel very passionately about euthanasia as one of the biggest blessings I have and can give to an owner and their pet when that time comes, and to make that be as equal and loving a decision as perhaps, moving forward with maybe $10,000 worth of care that maybe they can't afford to do. When we can't make them better, we can certainly give them the blessed, peaceful passing these little angels deserve. And that's, I believe in that so fully. I can't tell you all. And so Samson was a dog I never met. He was actually here in Lexington, Kentucky. He had one of our ER doctors was his primary care doctor at another facility when she wasn't doing an ER shift at the hospital that I consult at. She called me up and wanted to know if I thought that I used another product at that time that was a capsulated form, and she wanted to know if I thought that product would be beneficial for Samson because Samson had bone cancer and had intractable pain. He had a transdermal sentinel patch on. He was being given tramadol, an opioid anti-pain medication, gabapentin, a medication to reduce nerve-based pain, and also codeine. And nothing was touching this dog's pain from his osteosarcoma. And the owners wanted a week with him. I think other family members were coming in town to say goodbye, but they couldn't get Samson comfortable. And I told her, well, no. And using that product for 8 to 10 years, it's not going to touch that kind of pain. I'd never had much faith in the product that I was using at that time. And I said, plus you got to order it. And by the time it gets here, Samson's time's going to be gone and he'll still be painful. I said, but I have this new product. It's a liquid. And I think it's going to be it's going to be so much easier to give, and it's going to be so much more rapidly absorbed than the other product that I had been using. I said, would you let me run it over to your clinic and you can give it to the owner if she's willing to try it? I would, be honored to see if Samson could get some relief. I really, to be honest with you all, I was a little skeptical. This dog's on some big gun anti-pain medication. In the human world and veterinary world, and we weren't making a difference. And the owner gave 2 doses, gave a dose that night and a dose the next morning. And she called up the ER doctor that had, was our primary care doctor, and she said that they had to put a leash on Samson because he was acting like a puppy. They were afraid he was going to fracture his leg with the cancer that gets weak. And he said he was jumping around and feeling great, And so we gave him that sealed the deal for me. To touch that kind of pain, had he been my only one of all that product in the gold pack, I think I would still be on board because that was such a profound moment. If you can make a difference in one animal's life when those other drugs weren't touching it, my God, that's a win. I know it might not sound like it to most of y'all because we only had a week more with him, but he had a week where he was happy, he was eating, he was engaged and interactive with his owners, and he felt good in the face of this disease that was going to kill him. And so he had a very peaceful, controlled passing in the end. And that's something that I can't even put words to because I believe in so much in their dignity. We can do so much for our animals that I wish we could do for humans. And I think Samson just exemplifies that. For me, I always have to give him his accolades because he really drove home the fact that Ultracell is helping so many for his problems. Stephen, I can probably, just to circle back to that one picture that Stephen, you all didn't get to see it, but I had all these pictures of dogs that look like their owners, and we always like to end on this picture of Stephen next to Buddy. I'm starting to see more and more similarities, my dear friend.
I'm telling you.
Get you a beard and a mustache going.
It's coming along. Buddy's my homie, that's for sure. Joli, you are so incredible. I was actually just browsing through Facebook, just kind of listening and just absorbing what you're saying, and people are blowing up their Facebook pages with pictures of their pets and then sharing stories of how Ultracell has impacted their pets, and how so many people just need to give this product a chance. And Joli, you're an angel. I mean, just to be able to come on here with the the pedigree and the background you have and the credentials, and we are so blessed and honored to have you as a part of our family. And Joli, the results that again, one thing you've said many times that was always impactful to me is there is no placebo effect when it comes to an animal.
Right.
And
right.
so
I think that's true.
Oh, it's so true. This is such a gigantic, untapped market in our business. It really is extraordinary as far as the potential.
Do you remember the first time we talked? I know people probably ask you that all the time, but I remember telling you that I'd looked at your pet supplement line, and I said, you got to do away with that. I said, you've got everything you need right here.
That's it. Yeah. And Joli, we have a lot of people that are, hey, when are you going to put this into this and that? And it's not that we won't, at some point in time maybe, but again, guys, keep it simple. You know what I'm saying? Keep it very simple.
Well, and I get a lot of people telling me that too, Stephen, and I always tell them, I said, why would you make, it's too much processing. It's going to be too much expense, too much overhead. We have a product that is palatable, easy to give for the human and the dog, cat, horse, cow, pig, bird. It's what that, from a veterinarian standpoint, one of the cool things or neat things that Ultracell has done for me is I get to help my patients every day. But I've got a lot of clients who see what it's doing for their pets, and they start taking it. So I've helped the owners emotionally by helping their pets, but now they're secondarily getting some help with their health through me. And so it's just, it's so rewarding, enriching, fulfilling to be able to have this much excitement at this stage of my career. I'm 51 years old, and this has been invigorating on so many levels. And I don't believe there's any reason to have a different product. To have a tuna-flavored hemp capsule for a cat, or for, a chicken-flavored tablet for a dog is succumbing to marketing. That's all it is. It's the same product. So if you've got
we could do it, Joli. We would actually sell more because then people would have to buy both. And who knows? Maybe we will at some point. But
there's no reason.